My apologies, I had muted myself. I'll start again. Good morning, everyone. My name is Oraitile Museki, and I am the technical lead here at Frontline AIDS, working on human rights. I'm joined with an excellent group of panelists who are going to be helping me lead this session. So welcome to you all. I see there's tons of people on, and thanks for the chat comments that are in the chat box there already. So welcome again to this last and final webinar by Frontline AIDS entitled Under Attack, Challenging Human Rights Violations During COVID-19. So I would just like to hand over to my colleague Seb to quickly take us through the rules of engagement so that we can all feel that we're participating in the way that we can. Over to you, Seb.
Thank you, Artile. So this is a webinar hosted on Zoom, which means that as attendees, your microphones won't have been disabled, but we would still invite you to engage and make comments or ask questions through the chat function. And we also have a separate Q&A function, which we ask you to use if you have specific questions that you would like to put to the panelists. So we will be monitoring the Q&A function to take these questions towards the Q&A session towards the end of the event in the last kind of 30 minutes. We will be recording the event. That recording has already started. This will be posted to YouTube and it will be available on the Frontline AIDS website afterwards, and we can share with participants roughly 24 hours after the event. We also have interpreters who will be live interpreting for French speakers. And to access the interpreter function, as you see on the screen on the slide, there is a globe icon at the bottom of the Zoom bar. It should be on the right-hand side. If you click on that, it says interpretation, then there'll be a pop-up. You can select either English or French, and if you wish to mute the original audio, you just need to check that box as well. If you have any issues with the interpretation, please either write to me in the chat function. My name is Seb Rowlands, or to anyone kind of in the panelist group, and we will get that sorted for you. So that's all from my side. I pass back to you, Oraitile.
All right, thank you very much, Seb. So I hope you've all had a great week at AIDS 2020. I hope you've had a chance to look at our virtual booth on our website, where you can find it at www.frontlineaids.org. And I hope you've really enjoyed this week. We certainly have here at Frontline AIDS. Just a little bit about Frontline AIDS before we begin. We are a global network of organizations that work with the mission of ending AIDS everywhere for everyone. We exist basically to focus on marginalized populations who are often disproportionately affected by the challenges of being able to access HIV-related health services and justice. We comprise over 40 civil society and community organizations across sub-Saharan Africa, North Africa, the Middle East, the Caribbean, Latin America, Central Asia, the Asia Pacific area, and Eastern Europe, and other places as well. So I hope everybody is looking forward to this webinar we have here. I'd just like to quickly introduce our panelists who we have. Welcome Adrian Juco, who's the Executive Director for the Human Rights Awareness and Promotion Forum. Dr. Adrian Juco works for an organization, like I said, called HIRAF in Uganda, and he's joining us from Uganda today. HIRAF operates the only registered and specialized legal aid clinic catering to LGBT persons and other marginalized groups. And Adrian coordinates the legal efforts to defeat Uganda's Anti-Homosexuality Act of 2014 and continues to lead legal struggles in favor of LGBT persons. He has a book that has recently come out, so you can go and check that out, called Strategic Litigation and the Struggle for Lesbian, Bisexual, and Gay Equality in Common Law Africa. So welcome, Adrian. I would also like to introduce a colleague coming to us from Ukraine, Victoria Kalunyuk, who is the regional coordinator for REACT at the Alliance for Public Health, and she is a team member of the regional project called #SOS_project, which is a project that fits under a bigger grant called Sustainability of Services of Key Populations in Eastern Europe and Central Asia. And she manages the REACT project within that, which operates across 4 project countries: Georgia, Moldova, Kyrgyzstan, and Tajikistan. Next, we have a colleague coming to us from Harare in Zimbabwe, Chester Samba, who is the director of GALS, Gays and Lesbians of Zimbabwe. And Chester is a gay activist who works for GALS, which is an LGBT organization in Zimbabwe, which is involved in advocacy and ensuring GALS's visibility in a number of different sectors. Chester follows the political developments in Zimbabwe and monitors their implications on citizens with particular interest in LGBT communities. And last but not least, a colleague of mine, Jean-Éric Inkurugie, who is the lead programs for the Rapid Response Fund here at Frontline AIDS. The Rapid Response Fund is one of our flagship human rights initiatives in which we work across many countries in Africa, working with both established and nascent civil society groups to provide emergency grants to members of the LGBT community, sex workers, and people living with HIV whose rights to health and accessing health services are under threat, and where violations of their human rights have caused disruptions to their ability to access these services. So without further ado, and we have a final panelist who I will introduce a little later, Mette Honrijp, but I shall introduce her a little bit later. So we will start with a few words from each of our panelists here, starting with Adrian. So Adrian, we would like you to share a little bit about the human rights challenges that partners in Uganda are facing during COVID-19 and how they are responding on the ground. We would also like to know about how international solidarity can be leveraged in order to help overcome the human rights crises that's happening in Uganda, and perhaps a little bit about the role of donors in supporting this work. Over to you, Adrian.
Thank you, Rati. That's quite a ton of questions, but I'll try my best to respond as fast as I can. So one of the main issues that we are facing here in Uganda seems to be an attack of on LGBT persons under the pretext of COVID-19. And that's a very big challenge for all of us here because amidst this whole crisis, no one seems to be paying much attention to what happens to a small and marginalized community like the LGBTI community. So many organizations which run shelters where many people congregate because they actually have nowhere to go, many of them are being forced to stay with their families in the event of COVID-19, which is exactly problematic. And then the government has decided to start raiding shelters run by LGBTI persons. So we have a recent example where 23 persons were arrested from a house in one of the suburbs in Kampala and then taken to, they were charged with doing a negligent act like it spread infection of disease. And the disease they're talking about in this case is COVID-19. They were taken to prison and they spent there more than 60 days. And even just getting access to them was a big challenge. We had to go to court to just get access as lawyers to visit our clients in prison. And that was a big issue. Eventually they were released, but then right now we are fighting a case. Actually, after this call, we're going to be fighting this case, a case challenging Tokyo, violations including banning people between the buttocks just because they are gay, which happened to them when they were in detention in prison. And these are things we cannot speak about right now because it's time for COVID-19. We are speaking about bigger issues, and this doesn't seem to be a bigger issue, at least for the government. And that's generally is how do LGBT organizations continue to operate in a period of such, in a period with such violations. Already it has been difficult operating as an LGBT entity in Uganda. Now it has become much more complicated because your work is looked at like, your work is looked at as not being important. In fact, in the depth of the lockdown, we had our work declared as non-essential. We are not essential. We're not able to move and represent our class, even as lawyers. And of course, the other question now that comes in and tags into the bigger picture is, are we still, what's the nature of our work? For example, we provide legal services to LGBT persons, but in light of COVID-19, you find that people do not work most of the jobs where they go to work have actually been kind of stopped. They can't work, so they don't have a living. Many of them get arrested. And when you come in as an LGBT lawyer, you're giving them legal services. What does legal services mean when I have nothing to eat? And that's a key issue that we all have to think about. So as lawyers, we've been forced of recent to start providing food to people that we are supposed to be representing, not just them, but also the families they have left behind. And that has been an eye-opener for us, but also the issue of shelter. People have no shelter. They have nowhere to go. When I was getting these guys from jail, they asked me, you are getting us out of prison. We've been eating. We've been sleeping. Where are you taking us? Our families have already disowned us. So you as the lawyer, where are you taking us? I immediately realized that, okay, you can't just stop at giving them legal services. You have to do something more than that. And this is where I think the role of donors comes into the question that as donors, we have to think beyond the traditional ways of funding groups that work on LGBT rights and other marginalized persons. We have to think of how do we actually holistically support a human being? How do we holistically support an LGBT person in Uganda? Do we just continue our legal support, our advocacy support, or do we actually have to come in and provide humanitarian support to people? Protection in this time, for me, I think is very critical. Where do people sleep, shelter? What do people eat is something that even donors have to think about. As for international solidarity, it's always critical. For Uganda is coming into the election period. Very soon, we are going to go into campaigns. We're already doing our scientific campaigns, meaning that we are campaigning online. And this always comes with challenges for LGBT people. Already, LGBT people in Uganda are being blamed for the epidemic, as in we are being punished by COVID-19. And they're giving us examples that, you know what, Uganda doesn't have a dead person yet because we are very godly. Those Americans and other people are dying because they are ungodly and because they practice homosexuality. And the homosexuals here are the ones causing the few infections we see in our country. Now, that kind of narrative is actually very much believed. And also it's going to be much used during the campaigns for political office. How ready are we to protect people during the period of political offices? But also issues like drugs, access to treatment for those who are HIV positive. How are we going to address these issues in light of COVID-19? So time to speak out is now. When violations are happening, we communicate them. We want people to speak out. When the national community to engage and say that, well, despite COVID-19, LGBT community remains a priority. We have to look at it and also care for them, but also other marginalized groups. Thank you.
Thank you very much, Adrian. You've raised a lot of key issues. I mean, like you have said, the thing that COVID has really raised is not only has it exacerbated existing and intensified existing human rights violations, as we know, the targeting of LGBT communities and other key population groups like sex workers and others, but it has actually widened the scope of what we call humanitarian needs. But in some ways, those humanitarian needs are fundamentally human rights entitlements, the right to work, the right to shelter, the right to earn a living. It's encompassed a whole wide range of human rights issues, which has become a challenge. And thank you for discussing and for reflecting on the fact that donors need to take a much more non-traditional approach, a much more innovative approach to supporting individuals. It's not just about COVID and it's not just about HIV. It actually encompasses a wider scope of needs. Thank you so much for that. Moving on now to Victoria, we would like to speak to you a little bit about the work that you are doing in the region in Eastern Europe and Central Asia to introduce REACT, the work that you're doing on REACT, and how you have adapted REACT to respond to COVID. What has it done in order to change? How have you had to adapt and change your work in order to encompass the new and intensifying human rights challenges? What are the new types of human rights violations that are being documented as a result of COVID? And how has that kind of influenced the work that you do? Over to you, Victoria.
Imagine 3 out of 4 REACT nationally coordinating NGOs are now sick with COVID-19. We are now truly under attack. And today it's a great and very needed opportunity to share experience and strengthen our efforts. To start, just a brief introduction on what REACT system is itself. Developed by Frontline AIDS, it's a community-based human rights monitoring and response online platform to record cases of human rights violations experienced by HIV risk groups. And this system helps to provide support directly to the victim or refer them to health, legal, or other public services. So please show the map. data collected by React is implemented. Data collected by React should be used as a powerful evidence for advocacy at local, national, and regional levels. At the moment, we are working within a regional source project in 4 countries: Georgia, Moldova, Kyrgyzstan, Tajikistan, and we involve more than 23 cities and more than 40 NGOs. Thanks for the map. So we have started to document cases in January this year, and in middle March, lockdowns, restrictions, and quarantine measures started to be implemented in countries we work in. And to tell the truth, that was a shocking period full of fear and uncertainty. The first challenge was lockdown and restrictions chaotically enrolled or not, rather than virus itself. And imagine, we lost connection with a considerable part of our reactors. It's the people who document cases and most of our clients. So the first lesson we learned was that connection with reactors and with clients is crucial. It's important to ensure sustainable channels of communication to reach clients out and to be reached by them. So care about mobile and internet connection for outreach workers, street lawyers, community activists, hold regular calls to your clients and conduct online meetings. Also establish hotline or collaborate with governmental COVID-19 hotline or other crisis centers. And also, very important, try to disseminate business cards with emergency phone numbers so that victim can report when his or her rights are violated or any other support is needed. So after we restored connection and started to work online, we tried some new types of approaches and some new types of work. For example, in Georgia, reactors started to search for potential clients from LGBT community using Tinder social network, offering them some HIV prevention services and as well as legal support in case their rights are violated. So to find out more about some kind of success stories and COVID-19 response in HIV sector, I encourage you to visit our In Your Power platform using the link I will share later in chat. So coming back to COVID-19 challenges, I have to say that for a quite long period of time, we could not gather any case of human rights violation related to COVID-19 or lockdowns. And it's because simply nor clients, neither reactors could identify these new types of human rights violations. There were missing information on what rights and rights violations are in emergencies, what police, government should do and what they should not. So the second lesson we learned was that we should provide clients and street lawyers with current information and upgrade their knowledge on their rights, because situation is changing so rapidly that they have to be prepared and know how to respond. So now it's a great time for learning, for trainings, while we all stuck at home. And additionally, we have elaborated kind of brochures that explain what rights have to be ensured during emergencies and what typical human rights violations can occur. And it's important to use international recommendations from WHO, UNAIDS Human Rights Office, UNAIDS, but transform these recommendations into very simple language that is understandable for community representatives. And moreover, we are currently working on our first analytical report based on information gathered within React system in first 6 months of 2020. And of course, we will take in account COVID-19 aspect and analyze more deeply how it has influenced human rights in 4 project countries. And coming back to the statement I started with, 3 out of 4 national coordinating NGOs are now sick with COVID. So I want to emphasize that safety of our outreach workers, service providers, street lawyers has to be our task number 1. They are all in front line of both viruses and they need to continue their work in this turbulent time. So let's at least provide them with basic, all possible personal protection equipment, and let's keep an eye on them following these sanitary recommendations. So thanks a lot for your attention. Stay healthy and safe.
Wow. Wow, thank you so much for that, Victoria. It's just amazing the work and the how rapidly APH was able to adapt to the changing circumstances of things. What really resonated with me is around how innovative you have been in terms of meeting people where they are at, about really recognizing very early on that that connection was being disrupted between reactors and clients, and quickly kind of adapting with, you know, going on Tinder, the whole thing around business cards, you know, the hotline, partnering with other crisis centers. That's amazing. I think you're right. Bringing up the fact of the front people on the front line, safety coming first is key to the work that we do. It's fundamental. It's around do no harm for human rights defenders and ensuring that those people are safe in doing the great and crucial work that they're doing. I won't go any further into it, but thank you for that. I'd like to go next to my colleague Jean-Eric from Frontline AIDS to speak a little bit about the Rapid Response Fund and give us a little bit of an overview of how the Rapid Response Fund is finding solutions to new COVID-19 related challenges, how our partners implementing within Rapid Response are adapting, and just share some examples of that work. Thank you. Over to you, Jean-Eric.
Hi, Oratile, can you hear me? Thank you very much for the question. And I would like to first give a quick overview of what the Rapid Response Fund is. And for those who don't know the Rapid Response Fund has been led by Frontline AIDS since it was set up with the support from the Elton John AIDS Foundation in 2016. So it's a fund that has been in existence since 2016. It has been providing urgent small grants to LGBT-led organizations in Africa and the Caribbean when they are faced with human rights abuses that increase vulnerability to HIV. And since then, we have granted well over $3 million US in over 350 grants directly to community-based organizations. And we have reached more than 30,000 LGBT people with life-saving support. And what happened with the COVID-19? Obviously, because the Rapid Response Fund was already providing some emergency funding for LGBT organization, we had a surge, lots of applications coming from the LGBT organization that we had already been supporting, that were being impacted by COVID-19. And as the first panelist indicated in his discussion about what the impact of COVID-19 has been for LGBT people in Uganda, we started receiving a lot of applications for other interventions that were related to the fact that, you know, being LGBT people, they were being more affected by the restrictions taken into by the government to ensure that people were not getting COVID-19. So we had like tripled all the applications that we were receiving before. So we had to adapt and we had to decide how are we going to be supporting these community-based organizations to ensure that they can support their members. And I just want to draw back again to what Adrian said. Most of these community-based organizations, LGBT organizations, they were impacted by the restrictions taken by the government. They didn't have enough funding, so they had to support their members to ensure that they can survive. You know, most of them, they're being impacted more than, or exacerbating their vulnerability, their vulnerabilities actually. So we received a lot of applications, and what I can say, most of the applications were related to the fact that, you know, when the restrictions have been taken, they were not included, restrictions were not taking into account the other vulnerabilities of the LGBT people. And most of the requests were related to food support, to relocation for people to be able to be sheltered. And I will give two examples. For example, with one of our application in Kenya, for example, we had a clinic that was providing support to MSM or gay men accessing HIV services, but then with restrictions taken, curfew, time to work, they were not able to provide those services to their members. So they applied for a grant, and they were able to get a grant, and they were supporting the members, making sure that they can access the ARTs by going to where they are, as someone said it also. And what I would also like to bring to the attention, it's also the case of LGBT refugees who were being more impacted because they are not just LGBT, but they are also refugees or asylum seekers. And this is also in the case of Kenya, for example, and also in Malawi, where they are not included in any kind of response. So this community-based organization has to find a way to provide that kind of solution or support the members. And some of them, like in Kenya, they applied to be able to provide food again, but to also put those people in shelter so that they can be relocated somewhere safely. Because not only if they are not relocated somewhere safely where they can stay, they are not able to stay at home. I don't know if you have been following all the human rights violations being documented, but you know, in Kenya with the police brutality, if you find out outside with that, of the curfew, you'll be more likely to be brutalized. But also what I can also say that, you know, because the Rapid Response Fund, as you said also, Ratile, it's eligible in more than 30 countries in Sub-Saharan Africa and the Caribbean. And obviously you see some similarities and trends on what is requested by the organizations, what kind of solutions they are trying to provide to the members, to the community organizations. And another thing that I might need to say is that, you know, COVID-19 restrictions, protection not being provided to the member of the LGBT community or marginalized population, but also the fact that the violence that they are experiencing or they have been experiencing before hasn't stopped. And there is a need, you know, we had, for example, in Cameroon, where some of the members of the LGBT communities were arrested, and really within the COVID-19, I guess it's kind of similar to what happened to Uganda, although it was not related specifically to a shelter, but you had people being arrested and needing some kind of legal assistance and be supported. But once they get supported to get out of prison, how then they can also be supported to continue or be housed. And one other example I would like to share of what has been happening, it's an example of those who are most marginalized, even within the most marginalized, who are the trans people, who are always more at risk. And we got lots of requests for the community-based organizations to support the trans members who normally, because of the COVID-19 and because of where they are, the restrictions taken by the government, most of them are also sex workers. So they're not able to continue doing the work. They're not able to provide for themselves. So they needed support. And in the case of, for example, of, and some of them are also HIV positive. So they cannot, not only they cannot work, they cannot get any kind of income, and they cannot take the medicine. And even if they can take the medicine without the food, how are they going to be continuing it? So in the case, for example, for Trinidad and Tobago, we support one of the organizations to provide those kind of services to its members.
Okay, thank you very much, Jean-Eric, for raising all of those issues. And it's great that the Rapid Response Fund was able to to respond quite rapidly as we do. I mean, that is the kind of the bread and butter of what we do with Rapid Response Fund, is trying to really respond immediately to meet those needs. Thank you for also raising that even within the most marginalized populations, we often speak about collection of people. We talk about LGBT or sex workers, but we don't often even speak about those within those populations that are even more marginalized. You know, raising the fact that trans communities within those populations are even much more affected. You know, the intersectionalities, that the more marginalisms you kind of embody, the further out you are in society. So being able to kind of focus in and target those and access those populations and support those populations has been a huge and crucial thing that Rapid Response Fund has done to contribute to responding. So thank you very much for that. I would like to move now, finally, last but not least, we say in my language in Setswana, moja morago ke kgosi. In other words, the last one is king. So Chester from GALS, we would like to give you an opportunity to share a little bit about the impact that COVID has had on the already shrinking civil society space and how it has been exacerbated by COVID, the changing landscape, and give us some advice about what human rights defenders should be watching out for to try and combat this. I'll hand over to you, Chester.
Thank you very much. I think you should have tried Queen for that. So yeah, in terms of space, there are issues that we need to look at when we talk about space. And I think I'm tempted to look at personal space as it impacts or affects an individual in terms of COVID, also looking at institutional space, national, political, and international space. And coming from a country which is currently gripped with a very difficult economic situation, I think it creates a restless population, which sort of then unsettles government. And the temptation really is for government to try and monitor closely the work of civil society and try and close that space. And in such times, you'll find that fundamental freedoms are trampled on, could be through enactment of laws, could be increased repression, increased surveillance, abductions, detention, and interruption of meetings, basically. So that's kind of the environment in which we find that we've recently had a change of government, and from civil society's perspective, we've been trying to cautiously engage with the new government with the hope that we would see some change or shift in the way in which the previous regime also treated civil society. Rather than to complement the work of civil society, we always see that government always tries to control. And I think we as civil society also have a role to play to always had the work of providing oversight and supporting vulnerable citizens does continue in this environment. And COVID really creates a unique challenge for our communities because we already have limited rights, and COVID comes in, you would then find that there's a further limitation of those rights as we go on. But you also have other non-state actors that contribute to closing civil space. And I would like to mention the role of the media in this regard, in that also it also leads an onslaught on civil society leaders or the work of civil society, mainly of accusing it of trying to topple a government, which is something that always is labeled on civil society. And this then follows the arrest of civil society activists. We've seen a number of civil society leaders being arrested and facing charges designed to criminalize human rights work. And tied to that, I think we also noticed that our legal system is very weak. We have a situation where justice, we're not sure how it is used and managed in this country. It's very difficult really to seek justice through the court systems, for example. And the effect that we see basically is that with civil society, we always responding to these threats all the time, constantly. And we've never really gotten to a point where we get down to do the work that we have set ourselves out to do. So the civil society, I think also we need to enhance our expertise and capacity to hold or to engage the state on the fundamental issues around macroeconomic issues in the country that could then assist us to move forward. And I think we look at then how the international community can come in to support, what can be done is to look at, do we need to continue to invest in short-term wins, or we look at how can we sustain the work, thinking long-term, and also sustainability, I think, is critical. We also need to continue to raise the political and economic cost of human rights violations for the perpetrators. And I think that's something that a number of civil society organizations always try and do. And I think then this then means that we require assistance just beyond financial support, looking at issues around legal assistance, mental health support, and just practical training of equal importance when we really looking at how do we adapt to an environment that's also impacted by COVID. To use by government to close down civil society space. And I think issues of learning and sharing out in different contexts and apply to different contexts. So the desire to learn and share to generate interest in monitoring and responding to human rights violations could also be another way of ensuring that we continue to do the work. There are also issues around activism and activists. How do we enable activists to do the work, and how do we support activists who are on the ground? Given that it's now difficult to do things physically, how do we connect online activism or movements that have started to organize online and those that are on the ground? And I think that's key also to ensure that our work continues. I'll stop there for now.
Wow, thank you very much, Chester, for that a real elaboration on just how much more difficult. If we thought that civil society space was closing and government surveillance of civil society and human rights defenders was happening pre-COVID, COVID has just made that all that more difficult. So everything seems to just be intensified. Thank you so much for bringing up the fact that governance and the rule of law have been compromised, access to justice, the ability for us to actually do our work and to challenge these things is compromised in this situation. It's unfortunate, you know, at this moment that we are all being reactive, like you say. At one hand, we're being kind of reactive, trying to respond to the crises as they're happening. But that as we are doing that, you are also saying and recommending that civil society needs to invest in more long-term strategic planning as we go forward. Really important to mention how we need to intensify the investment in understanding the political and economic implications on states around human rights violations, what human rights violations are doing to undermine both political and economic needs in countries. That's huge. Learning and sharing is key across different regions, because as you have all seen, panelists and attendees, the similarities and the commonalities of the human rights violations that are occurring across our different regions. You know, of course there are differences, but there's a whole bunch of similarities, you know, in terms of what people are experiencing on the ground, and also connecting, like we say, our online activism with our grassroots in-country activism. So thank you very much, Chester, for that. We are running a little bit behind schedule, so without further ado, I would like us to welcome our final panelist. Her name is Mette Grongrijp, and she is the Director of Social Development, as well as being the Ambassador for Women's Rights and Gender Equality at the Dutch Ministry of Foreign Affairs. Let me just quickly give you a little bit about who she is. She joined the Ministry of Foreign Affairs in 1997, and Mette has served abroad at the Netherlands Embassy in Zimbabwe. Between 2012 and 2016, she served as Dutch ambassador to Costa Rica. And while in The Hague, where she is now presently, she has held various positions. After returning from Costa Rica in 2016, she served as Director, Sub-Saharan Africa, and Coordinator of Regional Positions in Embassy Network until taking up her current position in 2018 as the Director of Social Development. So welcome to you, Mette. Thank you for joining us. You've been listening to the panelists speak about the challenges and making recommendations for what can be done differently. Could you perhaps give us a few reflections on what you think the role of donors is in supporting this work to prevent, respond, human rights violations and defend rights? Thank you. Over to you, Mette.
Thank you, Artil, and thank you, panelists. My response will be twofold. I will first briefly respond to the panelists' interventions, and after that I will reflect on the role of donors and specifically the role of the Netherlands Ministry of Foreign Affairs. So let me start by emphasizing how important it is that to end AIDS we need rights-based policies and actions. And this was also the key message of the Netherlands 2 years ago, for those who remember, when we hosted the AIDS 2018 conference in Amsterdam. And as has been mentioned by the panelists, is more relevant today than ever before. And the COVID-19 crisis has unfortunately exacerbated inequality and human rights violations, as we have heard from the experience and the different stories of the panelists. The leading role of communities has been demonstrated during the COVID-19 crisis. We've heard that from the panelists, and we've also seen that in our experience. As a result of the lockdown, people could not collect their medication in the clinics, so community health workers jumped on their bicycles to deliver the life-saving treatments to people's homes. And the impact of COVID-19 is not only related to health issues. I think Chester made it very clear that there are mental health issues as well. The socioeconomic impact shows us that people are in need of food and psychosocial support. The food and the shelter issue and the needs, the more humanitarian approach was mentioned by Adrian as well. LGBTI persons disproportionately face issues like isolation, depression, and increase of violence. And within the HIV/AIDS response, the groups hardest hits, and we've heard that also confirmed by the panelists, are the key populations like LGBTI persons and sex workers. They face significant additional burden of stigma, discrimination, and in many countries, criminalization as well. And that is very worrisome. And this situation is worsened, as we've seen, as we've heard during the COVID-19 crisis. And we say, as the Netherlands, that is unacceptable. The Netherlands gives a strong political and financial support to community-led responses and multilateral organizations which put equal rights for key population like LGBTI persons and young women. And we've heard also how important that is at the front and the center of the AIDS response. And recently, on the 17th of May, the International Day Against Homophobia, Transphobia and Biphobia, the Netherlands supported and co-signed a statement on COVID-19 and the human rights of LGBTI persons. Together with the members of the Equal Rights Coalitions, we called upon governments to limit the repercussions of the COVID-19 pandemic on people identified based on real or perceived sexual orientation, gender identity or expression, or sex characteristics. This crisis should not be a justification to impose new constraints on or to scapegoat LGBTI persons. We called on all governments to ensure that all policies related to the pandemic, including, as we've mentioned, the importance of access to healthcare, information, housing, and financial and economic support, take into account the LGBTI persons' needs in a proactive and non-discriminatory way, in line with the statement by the UN High Commissioner for Human Rights. As the Netherlands, we combine our support to organizations with diplomatic efforts to strengthen the position of activists like Adrian. And this is more than ever necessary. It became so clear from what we've heard from the panelists in the context of shrinking civic space and the increasing regressive pressure on SRHR, gender equality, and equal rights for LGBTI persons. The COVID-19 crisis aggravates this problem, as we have seen in the increase of human rights violations and the criminalization of key population. And I think here I would like to repeat a quote by our Minister for International Trade and Development Cooperation, Minister Kaag. She said, we shouldn't yield to the pressure of conservative voices. And I think it's important to repeat and emphasize that here. The Netherlands is striving to end AIDS among key populations. We stand for, as I've mentioned, a human rights approach in recognition that biomedical approaches alone do not suffice to reach those groups that are hardest hit by both epidemics, HIV/AIDS and COVID-19, because as the previous speakers have alluded to, it is crisis upon crisis. Our efforts to combat AIDS are integrated in our focus on SRHR, and we address the root causes of HIV infections among key populations. Stigmatization, discrimination, and criminalization surrounding HIV/AIDS are social diseases that should be eradicated. The Netherlands is in close collaboration with WHO, UNAIDS, and the Global Fund, and the GFF, the Global Financing Facility, to ensure LGBTI persons and activists are included in global and national health policies. We need more Adrians at the decision table. Leadership has also to shift from the north to the south and lie with those individuals and groups that are directly affected. They know best what the communities require, what the priorities are. Advocacy and a call for accountability should come from inside. And the results from investments in community-led HIV/AIDS response like Bridging the Gaps, Pitch, and a New Love Alliance speaks for itself. It is a proven measure to have a meaningful and sustainable impact for people at risk of HIV and people who are living with HIV, especially in times of a global health crisis. A community-led response ensures health services to reach the people who most need them. While we see progress, and it's evident that when external funding disappears, a lot of essential work that is happening now will fade away. We need strong, resilient movements to push for more progress and to hold governments, the health infrastructure, and legal frameworks accountable for an inclusive response to HIV/AIDS and COVID-19. Unfortunately, those who are willing to invest in LGBTI persons, especially with direct and relatively unrestricted financial and strategic support, are few. And that is why I, as Ambassador of Gender Rights and Women's Rights of the Netherlands, stand for equal rights and equal access to healthcare and justice for LGBTI persons, people who use drugs, and sex workers. And I encourage other donors to make the same smart investments to end AIDS as a global health threat. Thank you.
Thank you very much. I couldn't even possibly summarize all those great statements. I hope we can get access to that wonderful speech so that we can maybe tweet about it and keep sharing, including all of the other panelists. The things that you've said have been resounding. I hope our attendees have heard all of that. It's lovely that you, as the Netherlands government has really been quite confrontational. I mean, there's a time for diplomacy and there's a time where in moments like this, in crisis, we need to speak what really matters. We cannot be mincing words and saying things around we don't have that time. We just simply don't have that time. Calling on governments to be accountable for their citizens and residents. There is no excuse, like you said, for targeting in these times the people who are already more marginalized when it comes to COVID, and using COVID as an excuse for targeting, for torturing, as Adrian has mentioned, for imprisoning, for harassing, the police brutality, all of that is just, it's simply not an excuse. Thank you for emphasizing also the need for really advancing global South leadership. The people who have the answers are those who are in those communities in which these things are happening. That capacity and expertise already exists there. So we should be listening to those voices. And we need more leaders like the ones that we have on these panels to have a seat at the table and to help direct and shape those agendas that are happening in countries. So thank you so much for that, Mette. Without further ado, we still have a little bit more folks to get through. We have some kind of closing remarks that we would like to ask of our panelists, starting with Adrian. Adrian, COVID-19 to many of us seems that it's going to be with us into the foreseeable future. There doesn't seem to be any end to it. And that also then brings with it the expectation that there'll be a continuation of further human rights crises and daily livelihood challenges. What do you, Adrian, see as being the major human rights challenges that are going to continue to exist or will be emerging? And what should partners on the ground be thinking about in order to prepare and ready themselves for this task ahead? Adrian?
Yeah, thank you very much, Rachel. I think certainly COVID-19 is not going away, but also from what I'm saying, at least from the perspective of Uganda, the restrictions due to COVID-19 are not going away soon. And this is critical, that in light of the restrictions, we've had LGBT people and sex workers being attacked, being denied their livelihood, and being facing all sorts of challenges. The measures that work for the rest of us don't necessarily work for them. Stay at home makes sense if you have a home, not if you are homeless, you know, and stop, and you can work from home makes sense, again, if you have a home, but also if your work can actually be done in a home. So for many communities that are marginalized, this is no option. And if this continues, then what do we think as activists, as NGOs, as donors, what do we all think we should do to support the communities that we are working with? So also, if you look at things like demonstrations that used to work for us before, petitions, speaking out, these things may not be able to happen because now we are having to speak online, not necessarily in a much more visible way out there in the public. So as organizations, we need to think, how do we continue doing our advocacy in a way that is more, in a way that can operate within the COVID-19 restrictions, but at the same time, maintain effectiveness. For me, I think that's critical. How do we think? How do we remodel our work? How do we do redesign? How do we plan ahead? Now, COVID-19, I think, has given us enough notice, as in it's here and it's going to be here. We have to change our programming. We have to change the way we do our work. And I think for me, that's a challenge that we do. So also, can we think out of the box? Can we start thinking out of the box? Can we start doing things that are not necessarily the things we've been doing every other time? That's important. How do we continue supplying drugs for those who do supply drugs? How do we continue doing legal work in light of COVID-19? How, I as a lawyer, how am I going to have clients in my office? Should I wait for them to come, or should I actually go out to them and meet them? All those are different models that we have to rethink. How do you do work in light of COVID-19? And then for me, in light of Uganda, again, I think tagging the issues of COVID-19 and the issues of marginalized groups into the issues of governance. Uganda is facing a governance crisis right now, and this may happen in many African countries. How do we tag the broader discussions of violations of LGBT rights to the broader discussions of governance? How do we use the next upcoming election to make sure that issues of marginalized people are seen? How does the LGBTI group and sexual group form some sort of block vote for a particular community, for a particular politician that is in support of them? All these are things we need to think about. All these are things we need to be ready for as organizations working for on issues of marginalization and also HIV/AIDS.
You know, yeah, you've said it. We have to be out of the box, innovative, not just new solutions, but also maybe reflecting on the old solutions that we had. You know, the use of radio, because we know radio reaches those remote populations that might not have bandwidth, that might not have computers or even have that. So kind of rethinking our model around programming and the areas that we need to tackle. Thank you very much for that. Now, a similar question for you, Victoria. Just to speak a little bit about, based on what you have learned at the Alliance for Public Health and the work that you are doing there, and from the work on HIV and community responses to COVID-19, can you just share with us what kinds of lessons would help strengthen other civil societies' preparedness for other future destabilizing events and crises, whether COVID-19 continuing or new ones as they arise? What are some lessons that you can share with us around preparing for that?
Well, for sure, we will use the ideas and innovations we implemented now, so we will make them continue. and like continue working. So we will work on connection, internet connection, hotlines, and also radio, newspapers. All these old and new ways of communications have to be ensured. So we will like make all possible to make these channels of communication work. And another thing is, as I mentioned in my speech, that it's important to upgrade knowledge of street lawyers, to make them aware of these new types of human rights violations, to prepare them for this new environment and new reality. And so this will be our also priority for next months, is to upgrade their capacity and knowledges according to the new situation we live in. And there were another question you asked me at the very beginning, but I unfortunately had no time to answer, about new types of human rights violations we have documented. I consider this information very important, so if it's possible, I would like to share now. Do I have time?
Sorry, I said yes, 2 minutes, go ahead.
Oh, okay. So, it's important to say that what do we see now? It's like COVID-19 and lockdown, it's kind of enhancer of existing problems in the country. So, for example, if before in Kyrgyzstan, police was constantly detaining drug users on the exit of OST site, so now they're doing so even more frequently, because now drug users are provided with a bigger dose of methadone for a couple of days. So if before in Tajikistan, stigma against HIV positive people was so deeply rooted in society's mind, so now imagine there are appearing very, very popular gossips that it was HIV positive people who brought COVID-19 into their country. And if before we could observe a huge lack and denial of health services, so these services and the new ones related to COVID-19 for sure will not be available with the beginning of epidemics and restrictions. And if before there were human rights related barriers in accessing prevention and treatment services, so now people face with additionally obstacles such as movement restrictions, and for example, they cannot access medical facilities because these facilities are restructured to COVID-19 response. So if before HIV topic and key populations were not #1 priority of governments and healthcare system, so now they are like very far away of this priority list. And like I would like to use this opportunity to say that our task for today and for the future is not to let governments to forget about HIV prevention and treatment during this battle of COVID-19. Also, I have another question in the chat. Maybe it will be later. Tell me, manage this, please.
Sorry, you said you had a question?
Yeah, I see that there is a question in question section of our chat. So do you want me to answer now, or?
No, let us maybe get through all the reflections and then we'll get to the questions. Okay. Thank you very much for that, Victoria, for sharing with us the fact that we need to do better. I mean, enhance our legal literacy for reactors, for our lawyers to be able to encompass all the new and emerging human rights violations. And I think it's important to also share that learning with other human rights defenders so that we create a comparable data set, one that we can use to kind of generate more global level data on this. So thank you for kind of leading the way as APH in that innovation. I'd like to move on now to speak to you, Chester. Frontline AIDS Global is an international network of civil society partners and allies, including GALs. What can we do in the name of global solidarity to defend and advance social justice and rights for all? And also, what should we not be doing? So I know you've spoken a little bit about it. Would you like to elaborate a little bit more on the things we really should be doing, but perhaps the things we should not be doing as well? Over to you.
Earlier around the need to look at how can we think long-term, maybe in as much as short-term wins are great in certain we really need to think long-term and how to sustain the work that has already been done on the ground and continues to be done. I also spoke the need to support communities to raise the political and economic cost of human rights violations for the perpetrators. There are also issues around, like in our context, we are always quick to adapt to everything. Maybe we also need to look at, in as much as there are strategies to adapt, we also need to look at how can we begin to resist some of these challenges and really hold our governments accountable, so that the work continues. And for that, I think we require that support. I also spoke earlier around the flexibility that is required to be able to look at issues of legal assistance, mental health, and practical training, really, to be able to respond to the challenges that particularly LGBTI communities face. I also spoke earlier around the need to look at learning and sharing, creation of that knowledge, and really be able to respond to issues of how do we monitor the human rights violations and be able to respond to them effectively, and enabling activists as well, and activists by supporting them throughout their work. I spoke also of the issue of connecting online and on the ground movements. I think that's also something that we see now in light of COVID-19. What you should stop doing, I think you've really prioritized key populations in the response and continue to place them at the center of the response. And I think earlier on, Mette spoke around the South focus that you should also continue to do. I can't really think what you should stop doing, but I think you should continue to look at us and work together and collaborate with the communities on the ground and allow them to lead like you're doing. So thank you very much for that.
Thank you so much. I've taken a whole shopping list of points here of all the recommendations coming from everybody. This is great. I also just wanted to mention, and it maybe links up with everybody else's points that we've been making, linking really to your reflection on the long term and sustainability, is we need to get to a place, I think, my point of view is getting to a place where we are getting ahead of the needle a little bit. We're not just reacting and responding and monitoring, but the data that we're getting, the monitoring, if we do a good enough job, it helps us to preempt things that are happening. It's kind of also what Adrian is saying, is we know elections are taking place, they are coming up. How do we now prepare and then be able to preempt violations from taking place? You know, mitigating against it, not just the impact of COVID and the current situation that's happening, and to prevent further human rights violations from taking place. That's my own personal ambition. Thank you very much, Chester. And there's one last question, and it is an open question to any of the panelists, including you, Mette, including others that might be on the call today, is really around trying to enhance donor support for the work. I mean, Mette has given us a good foundation, lots of great recommendations, but what can donors do to really bring out the human rights defense into their programming and into their funding and prioritizing it? It can be a question to anybody, including Jean-Eric, whom we haven't gotten a reflection from. What more can donors do really to support this work? Any takers?
Emphasize, if I may, this is Mette here.
Yes, Mette?
Yes. No, I think I would just like to re-emphasize the importance of the combinations of what we've been calling the Dutch approach, but I mean, it is a broad approach to supporting key populations, and that is the combination of a pragmatic and a principled approach, where really the key pops are at the core and center of the response, where we have community-led initiatives, where there is local leadership, and where the approach, the programs is really rights-based. It's not only seen as a health issue, but as a much broader human rights issue. I think that is very important and something that we should broadly share and advocate for within the community to make sure that our responses are relevant and effective. And the other issue I would like to mention, we've been talking about this as well, but just to mention some figures, I think currently around 57% of the total resources for HIV/AIDS response in low and middle income countries in 2019 were from domestic resources. And I think also there is an interesting point to look into. How can we, through local lobby and advocacy by civil society organizations, by LGBTI groups, make sure that the domestic funding for support of key populations in the broad sense that I mentioned, the human rights approach, increases, because I think that is something that we sometimes underestimate, how important that domestic funding and the fact that these issues are high on the domestic political agenda are, because that is really relevant and key also for moving forward at a country level.
Yeah, absolutely. Really, absolutely. Domestication. I mean, donors are only one partner of several. Public sector as well in country, not just governments, but the role of public sector, of businesses in supporting their communities on the ground. That's a great one. Thank you all to all our panelists for your great contributions. Thank you for joining us from all over the world. Now it's time, we're going to take some questions. Unless, sorry, Jean-Éric, did you have something you would like to add?
Yes, I just had,
Okay.
well, I just wanted to respond to the question about what can donors do more.
Yeah, yes.
I mean, this is a reflection about, looking at what COVID-19 has been and how it has affected and the impact it has had on the community we serve and the kind of programming we do for human rights programming and what COVID-19 has showed, with the request, with the communities and organizations requesting all these non-legally or legal framed requests. We talk always about human rights violations and you need to do the advocacy work, you need to change legislation. But with what has been happening now with COVID-19, it's also showing what it's lacking when we have, marginalized population not being supported, to have flexible grants to be able to respond to the needs of those people they are supporting. I think that for me, what I would say, and this is not too long term, but at least, we talk about COVID-19 is not going away soon. The restrictions are still there. And what can donors do now to support going forward? I think that there is a need for flexibility to allow organizations to be able to respond to the needs of the people they are, or the beneficiaries they are supporting, and to not only look at the legal framework, but look at what is also needed for the beneficiaries or the people they are supporting.
Yeah, no, absolutely. And also just to, decriminalizing homosexuality, sex, I mean, all of these, the legal enabling environments are only as good as they are enforced in country. So, laws are only as good as if they're being executed and being acted upon and promoted and fulfilled in society. So it's kind of that balancing act. Thank you for sharing as well, Jean-Éric. I would like now to hand over to my colleague, Seb Roland, who is the Senior Advisor for Policy with Pitch, to lead us in a discussion. There's a couple of questions coming out. Seb, over to you.
Thank you, Artile. Yeah, so we have about 15 to 20 minutes now for the Q&A part of the session, and we would really like to hear from any kind of people on the call who are from key population networks or from the communities that we're working with on the ground. If you would like to ask a question or kind of share any experiences, we invite you to do that. And we also invite any donors or members of the international community who are on this call to respond to those if you'd wish to. So I'll just ask you to, keep typing any questions that you've got into the Q&A function if you haven't already. And in the meantime, we've had a couple of questions through. I think following on from, I think this flows nicely, the questions around what donors can do. There's a question from Maria Phelan at the Robert Carr Network about, I think this is partly being addressed by those responses, but maybe to follow on, the part of her question which asks, how can we innovate in terms of what the donor community can do to adapt practices? How can we innovate, and what would be most useful? Is there anything that any member of the panel would like to add to what you've already said that would be additionally helpful? Perhaps I don't know if Adrian or Chester, if you wanted to add anything further to the things you'd already said on this. Perhaps we can have another question at the same time to give you a bit of time to think about a response for that. We also had a question in around LGBT rights specifically. Are any of the panelists involved in or aware of advocacy work building on the evidence of individual human rights violations relating to COVID-19 restrictions? For example, putting pressure on a government to ensure the inclusion in the national response to COVID of LGBT people and organizations that serve them.
Yeah, I'll take that a little bit first. It's not necessarily what we're doing is advocacy work in terms of doing strategic litigation. So we want to bring this to the attention of the government through the courts of law. So when we are denied access to our law to our clients who had been arrested during COVID-19, we had to go to court to seek a court order to allow the prison authorities to give us access to the prison, which the court actually gave us. And in that process, we involved the Attorney General, the Director of Public Prosecutions, who actually dismissed the charges eventually against the 19 after we gave them evidence that actually this arrest was not due to COVID-19, but rather due to sexual orientation and gender identity, and they dismissed the charges. Right now, we are going to file a case challenging the violations in prisons that I talked about before. So that's the kind of advocacy, using the courts of law and the law to actually engage the government and the different authorities. When we were filing the case, we first wrote to the prisons officials, telling them to remedy the defects that we had done, the violations that we had done against our clients or in prison. They haven't responded. That's why we are suing them. So for me, first we're doing advocacy in terms of making them realize this through the courts of law.
Thank you so much, Adrian, for responding to that question. I think we have a nice question, particularly, I think this for Victoria. So the question is from Fanula. We've heard a lot of great kind of examples and experiences in relation to the LGBT community, but it'd be great to hear more about people who use drugs. So the question to you, Victoria, how are people who use drugs affected by COVID-19 in particular? Could you share anything more around that based on your experience with REACT or with Alliance for Public Health in Ukraine?
Thanks for the question. So what I can say now is that we do have evidence of human rights violations related to drug users. Of course, it's not like a huge base of evidences. It's just one by one separate cases, because as I said, reactors and people still don't know is it human rights violation or not. So like we are just starting to receive this evidence of human rights violations. And what do we see now is that the main violations now happen when accessing OST, because, as I said, police use this idea to distribute methadone for a longer period of time. So police use this chance to catch drug users and accuse them in having the big amount of methadone with them, carrying big amount of methadone. So that is like what we see in every country, is that like police is waiting on the exit of OST site and catching people who are exiting from there with methadone. Also, another thing is related to lockdown. There were some cases in Kyrgyzstan. They had like curfew. I hope I'm pronouncing right. So like time when it's not allowed to appear on the street. It was like from 9 p.m. to 6 a.m. And police also used this as a purpose of arbitrary detention of drug users, like as if they are not following this rule of these hours where you cannot stay on the street. But in reality, they just wanted to catch them, to ask for bribes, to blackmail, and to make statistics, like to say like they are catching a lot of criminals, and like to make bigger statistics. So that's what we see now, like using restriction measures against, especially against marginalized groups of people, and using OST sites as a like spot where you can catch drug users and like create some case on them, like, or accuse them on stealing they didn't do, or another type of crime. So that's what we can see now related to drug users.
Thank you so much, Victoria. That's really great to get that perspective as well, and to kind of see the different impacts for the different communities and how that's being affected by COVID a bit differently. A follow-up, this is the kind of second half of Fionnula's question, which would be great to follow up with Mette, please, if you could. Just a bit more, if you could share, how is the Netherlands, the Dutch government, responding as a leading donor to harm reduction during the time of COVID?
Thank you so much. Sorry, I had to unmute. Well, what we're doing is continuing the programs that we're supporting. I think that is something very important, and also continuing the political and diplomatic efforts that we have started in the past and that have become even more important now. We always have this like twofold approach, and that also goes for harm reduction. And of course, we see particularly in this COVID period where there are so many challenges, where already vulnerable groups become, as we have stated together and concluded, already more vulnerable. It's even more crucial to be able to support the key populations and people who are using drugs, particularly on their priorities and what they need, and also see how they can show leadership in terms of indicated how their rights are being harmed, how they can now come up with new plans for further support to make sure that their situation improves. So I think that in short, we can say that we continue our programs, but that the COVID-19 crisis has made all our programming more critical and more intense, and we have to adapt more to the local situations also because of lockdowns and quarantine. We see that situations on the ground differ from country to country, from city to city, from region to region. And that also means that the community-led response is so important, because those are the people on the ground, the keep ups themselves, they know what is required, and we have to make sure that as much as possible we support their efforts. Thank you.
Thank you very much, Mette, for your responses there. That's really great to hear. We have time just for a couple more questions, and there's one question that's come through from David Clark, which I'd like to ask of Chester, because you mentioned already about the importance of supporting mental health. So David Clark's question is, what do the panelists, so Chester, sorry, what do you suggest we do to protect and support the mental health and well-being of human rights defenders on the front line? And anyone else who might also want to respond to that question as well. So Chester.
So I'll just be brief on this. I understand that different organizations, different populations respond differently to issues of mental wellness and mental health. Sometimes just fear, and they design different methodologies, such situations where probably just burnout or depression, that they need to deal with that. So it really depends with the different contexts, and I think a number of our groups have develop different strategies which they can adapt or use to deal with such situations.
Thank you, Chester. Would any of the other panelists like to respond to that question as well? I think it's an important one. If not, there's another question which has just come through as well from Thabo. Which is also maybe something we haven't covered so much in terms of the personal sphere. So the question is, what are most of the violations happen at home under lockdown conditions? How do we ensure that we capture those violations as movement is also limited? So perhaps I could point this question towards you, Victoria, thinking about the React tool.
Yeah, well, that was the challenge we faced with, like, we lost connection with people who normally was coming to NGOs, like some spot we could meet them, and then the movement was restricted and like connection dropped out. And so the idea, like we invented, was like this disseminating of business cards, so like emergency phone number, like just a business card, small card with a phone number of reactor in the city, or some hotline or any phone number, and these cards could be distributed with IRV treatment delivered to the homes of patients, or maybe with some food delivered by NGOs, so somehow delivered to homes of clients or patients, and so have this like connection by phone. Of course, internet is not everywhere, and it's complicated to connect with people online. But for example, you can also use radio or newspapers, something which is constantly delivered to people's homes, to make this announcement that, like, in case your rights are violated, please contact us. We will help you, or try to help and assist you, or at least we will know that what happens generally in the country. So my advice is, like, try to bring something to person, to be connected with this person at her home. For example, advertisements in newspapers, radio announcements, or business cards with emergency phone numbers.
Thank you very much, Victoria, for that. I think that's a really important aspect, which is often hidden because it's in the private sphere. So that's really helpful to get your perspective on that. I think we'll take just one more question, and then we'll go to the wrap up. So the final question from Lois Chingandu, who is at Frontline AIDS, to any of the panelists who would like to respond to this. Could you comment on whether any of the organizations, so from your organizations or partners maybe that you've worked with, have any organizations preempted potential human rights violations and put in place mechanisms to prevent these from happening, rather than just being reactive? And would any of the donors potentially look to fund this kind of work? So I'll open this out to all panelists, if any of you would like to respond to this.
I'll go a bit. So I think violations, and we began to sort of see trends and monitor those and develop strategies around how we could better prepare ourselves to respond. That is also improving our protocols line, and ensuring also this information was shared with communities for them to better understand the environment in which they are operating in. So sort of the do's and don'ts online, and also looking at just the physical space, the personal space, how one could security policy that also then we do with different partners. How do we conduct that? You begin to analyze these trends, you develop you are able to picture a system and respond to this and be proactive than to be reactive. And yes, I think there is support out there for organizations to develop strong security systems and to better react to situations where human rights violations occurs in their community.
I think we might have just lost Chester there. Apologies for that. That is one of the challenges of doing events online, which is a shame, but that was really great to hear from Chester, his thoughts in response to that question. I'm afraid we are kind of at time now. So I would like to invite Orotile back just to do the final summary and close out of this, and to say thank you to all the panelists for responding to those questions. So Orotile, over to you.
Thank you very much. Yes, with 2 minutes to spare, I'd like to just really thank all of our panelists for the tons of people online who've joined this webinar today. It's just been really astounding and just amazing to hear all the great work. Apologies for the questions that we're not able to answer. We are taking note of them and we are recording them and giving them some good consideration. Thank you for the comments in the chat box, tons of them. Just to quickly wrap up in 5 or 6 points, to emphasize collectively what has been discussed is really the need for Southern leadership, or local leadership, the need to hold our governments to account, make sure that they are really manifesting the governance that they are required to do as state actors, the need to really push our donors to prioritize human rights related challenges that have arisen and been exacerbated in this time. And to also really give good consideration to the flexibility needed in an environment that is quite uncertain and where planning is really difficult to do. We can't anticipate things that are happening, and the need to be quite agile, to be fast, and to be flexible in understanding the real life challenges that are happening on the grounds. Donors need to kind of really be aware of that, to acknowledge that. Importance of us continuing to do no harm when it comes to supporting human rights defenders and others at the front line who are doing this great work, making sure that they're safe, both in terms of not contracting COVID-19, but also, mitigating against for instance, the police brutality that a lot of human rights defenders have to face in trying to continue to do their work. Recognition of the new emerging human rights challenges, as well as the exacerbation of old ones, and the need to also encompass a wider scope of humanitarian responses in the work that we're doing, and having everybody come to the table. And then finally, the innovating that we continue to do, and the adaptations that we need to do in both the things that we are programming in the content and the areas that we work, how we're doing that work, how we're innovating and changing to adapt to the realities on the ground, and acknowledging the widening scope of marginalized populations that continue to be kind of disproportionately affected by the COVID era right now. So thank you to everybody on the call, and we hope to be in touch with you soon. Just to reiterate that this recording will be on where will it be? It'll be on YouTube. Could you just reiterate that, Seb, where we'll be able to access